Hello everyone, and welcome. Today we're going to talk about a topic that can feel, well, pretty overwhelming for parents and caregivers, hydrocephalus. Our goal here is simple, to bring some clarity and understanding to the conversation, using expert information. So let's dive right in.
And that's really the perfect place to start, isn't it? When you first hear a complex medical term connected to your child, it's just tough. It can feel like you're left with way more questions than answers. And you know what? That feeling of uncertainty is completely normal. This is all about helping you navigate that.
So, what is hydrocephalus really? Well, at its core, it's a fluid problem. Our brains have this special fluid called cerebrospinal fluid, or CSF, that acts like a cushion. With hydrocephalus, too much of that fluid starts to build up, and that creates pressure. Think of it like a plumbing system in your house that's just not draining properly.
Now, it's really important to get that hydrocephalus isn't just one single thing. It can be congenital, which just means a child is born with it. Or it can be acquired, meaning it develops later on because of an injury or an illness. And those big medical terms, communicating or non-communicating, they're simply describing how the fluid's flow is being disrupted. Is it a blockage, or is it a problem with absorption?
Okay, so understanding the condition is step one. Step two is knowing what to look for. Let's talk about the signs and symptoms, because they can actually look pretty different depending on how old a child is.
What you're looking for really changes with age. For infants, the signs are often physical things you can see, like their head growing unusually fast or that soft spot on top feeling tense and full. But for toddlers and older kids, the symptoms might be things they can actually tell you about, like my head hurts or feeling sick to their stomach, or even having blurry vision.
The main takeaway here is pretty simple. Always trust your gut. If you notice any of these signs, especially a fast-growing head in a baby or headaches that just won't go away in an older child, it's time to call a pediatric specialist. Your instincts as a parent are so important.
So once you do reach out for help, what happens next? It might feel like a leap into the unknown, but it's not. There's a very clear, structured process that doctors follow to find clarity and figure out a path forward.
This journey usually follows 4 main steps. It all kicks off with a really detailed exam and a chat about your child's history. Next up is neuroimaging. That means an MRI, or for infants, an ultrasound, to actually get a look at the fluid buildup. After that, specialists team up to decide on the best treatment, and, this is crucial, they start planning for long-term support right from the beginning.
Let's dig into that treatment and support a little more. Because a diagnosis is not the end of the story, not by a long shot. It's really the beginning of a management plan that's all about making sure your child can thrive.
The most common treatment involves something you've probably heard of, and it brings up a really big question. What in the world is a shunt?
It's one of the most common and, honestly, effective treatments out there. A shunt is basically a tiny, flexible tube that acts as a new drainage path. Remember that clogged plumbing system? The shunt is like a bypass pipe. It carefully moves that extra fluid from the brain to another spot in the body, usually the abdomen, where it can just be absorbed safely. And that relieves the pressure.
Which, of course, brings us to the most important question of all, the one that every single parent and caregiver is asking. Can my child live a normal life with this?
Yes, absolutely yes. I want you to hear that loud and clear. With the right care and just regular checkups to make sure everything's working the way it should, so many children with shunts go on to live full, active, wonderful lives.
And that really leads us perfectly into our final section. What does the long-term outlook look like? Because managing hydrocephalus is definitely a marathon, not a sprint. It's all about living well for many, many years to come. Okay, but let's talk about the big what if. It's a very real and understandable fear for parents. What happens if the shunt gets blocked, or fails, or gets infected? That's a serious concern, and there's a clear plan for it.
The absolute key to long-term success is monitoring, and this is where you, as a parent, become the most important player on the team. Through those regular follow-ups, you're taught exactly what to watch for. You become the frontline expert in spotting any early signs of a problem. You're an essential partner with a medical team that's ready to jump into action fast. It's a system built on partnership.
And that really brings us full circle, doesn't it? Navigating a diagnosis like this is all about replacing that fear with knowledge and replacing uncertainty with a clear, solid plan. It's about finding a team that brings calm, clarity, and strength right when you and your family need it the most. The road ahead is one that requires paying attention, for sure, but it is absolutely a road filled with immense hope.